There's the call.
Yes, finally here. Terrific. So look, yes, I've got some questions to ask about maternity services. And so I understand the National Maternity Services Plan concluded at the end of June 2016, so almost 2 years ago. And that since then there's a new process underway to develop a national strategic approach to maternity services. That's correct?
That's correct.
Yes, and that's currently open for consultation?
That's correct, Senator.
Yes, so firstly just want to know, can you sort of fill me in on how that consultation is going, what stage that's at, how much engagement you've had so far?
Right, okay. So there's been, under the auspices of the COAG Health Council, the officials have got together and asked us to take the lead around the development of strategic plan. And as you've mentioned, there is a consultation process underway with a number of key stakeholders, and I'll hand over to Ms Cole to provide you with all the details of the consultation process.
So, Senator, first of all, I might not be able to provide quite as much detail as you'd like because this process has actually been run by our Chief Nursing and Midwifery Officer, and she's currently on her way back from WHO. But I'll do the best that I can. Thank you. So there's an advisory group which has all the major stakeholders on it. There are about 25 different stakeholder groups, including consumers, on that group. It has obstetricians, midwives, general practitioners, academics and consumers from both the public and private sector. So they are the sort of standing consultation arrangement. They also have some nice diversity in terms of rural and regional settings, Aboriginal and Torres Strait Islander communities and all those sorts of things. And they're jointly co-chaired by an obstetrician, Professor David Elwood, and a midwife, Miss Helen McCarthy. And they will be with us, I guess, in a sense, throughout the process. And then those co-chairs are also involved in the state and territory and Commonwealth discussion around the national strategic approach itself so that we get those linkages. In addition to that, there are consultations being done right throughout Australia. I think the next one is actually in Toowoomba, and there is also an online submissions process, various workshops and focus groups.
And what's the timeline then of those consultation processes?
So this is where my detail is running out, Senator, so I'll have to take that for you on notice.
Okay, so so do you know? So you don't even know sort of when that consultation process? Well, do you know what the timeline of having the new strategic approach is going to be?
So the outcomes of that consultation with the group and then also with the consultations around Australia is going to inform the new strategic approach. And then I think they will go out for a further round of consultation before they finalise the approach.
Right, okay,
Yeah.
but you
so
can't...
it's a while away.
It's a while away, but
Yeah.
you can't tell me when.
No,
Right.
Senator, I'm sorry, but I can take that on notice for you.
Okay, thank you.
Yeah.
Look, I understand in terms of the old National Maternity Services Plan that I understand there was a commitment from the Australian Health Ministers in 2010 that there was going to be an evaluation of that plan done to inform development of the new national plan. So has that evaluation occurred?
There was a final report done, but not an evaluation per se, Senator.
Right. So that means that the new strategy is going to be developed then without a formal evaluation
That's
of
right.
the plan?
So there were reports, sort of progress reports and a final report at the end of the previous plan, but not a formal evaluation per se.
So what was the process to decide that there wasn't going to be a formal evaluation, given that the health ministers decided in 2010 that there should be an evaluation of the plan? I would have thought that evaluations were pretty good practice.
Yes, Senator. I believe that essentially the states and territories and Commonwealth didn't feel that there was much that could be added that weren't already available in the reporting process that was already underway.
So there's no independent review then? I mean, that's the report of the people who were rolling out the plan.
Yes.
One of the purposes of an evaluation is to get an independent review, an independent look at what has been undertaken.
I understand what you're saying, Senator, but that wasn't undertaken.
Right, thank you. Can you expand on the role and the makeup of the strategy project reference group?
So the project reference group consists of senior officials from each jurisdiction, and it's chaired by Miss Deborah Toms, who's our Commonwealth Chief Nursing and Midwifery Officer, who's unfortunately overseas right at the moment. And as I mentioned, the senior officials group, or the project reference group, also has the co-chairs from the advisory group to bring that sort of context into play. So essentially it's a Commonwealth, State and Territory group with the co-chairs from the advisory group also attending to bring that consultation level through.
Right. Are there any community representatives or consumer representatives on that advisory group?
Not on the...
On that reference group?
On the advisory group there are, but not on the project reference group. So the role of the chair, the co-chairs, is to bring through those views of all of the members of the advisory group. And in addition, the consumers are being consulted on those broader consultations across Australia, and then the second round after the first draft is done.
So they're being consulted with, but so you haven't got consumer
So there's consumers
representation on the overall reference group though?
That's correct. So there's the co-chairs from the advisory group have responsibility of bringing forward the views of that whole group, which includes the consumers.
Was there a particular reason to exclude consumer and community representation on that reference group?
The reference group itself is primarily meant to be where the states and territories discuss and I guess in a sense collaborate and also sometimes disagree on what the final national plan will look like. So often in these circumstances you'll only have a state and territory and Commonwealth group doing that final consultation. In this case they've actually brought in the two co-chairs to make sure that it is informed by community views.
Yeah, so they're being channelled by that. Well,
Yep.
Going on to the advisory group then, in fact both the advisory group and the reference group, are they considering the broad range of issues like funding, workforce and breastfeeding?
Discussion paper. There is a discussion paper, I believe, on these issues more generally. I expect that a huge range of issues in maternity services and strong views will be expressed throughout all the consultation processes.
Are there terms of reference for the project reference group and the advisory group?
There are, and I can see whether they can be tabled, Senator.
Okay, thank you for both of those. That would be very useful. So you feel that the scope of the advisory group is broad enough to consider the full range of issues that will be brought up in consultation?
Whether the final plan or not incorporates every issue that's brought up is a different issue, but I think that the consultation process is so wide that all of those sorts of issues that you mentioned will be canvassed one way or another.
Can you comment either from what was in the old plan or what's been considered for the new plan on the importance of women being able to access continuity of care when it comes to midwifery services?
Senator, this is not continuity of care generally is very important for all patients within the health system, particularly over a course of the service, where there's many episodes. However, this is not actually an area in which I'm an expert in terms of the clinical needs or clinical benefits. I wonder whether our CMO or Deputy CMO might be able to help on that issue.
I can briefly comment because I've had discussions about this advisory group with some of the members. I think it's a very clear part of their role is to look at providing good high quality access to midwifery care and in a integrated framework, and I think there are clearly some issues with community-based midwifery care working in isolation at the moment. So I think that's one of the key issues that this advisory committee is undertaking to look at. That's what I've been advised anyway.
So that continuity of care of midwifery services is a key issue then.
It is, yes,
to be looked at in this.
There's very strong representation of midwifery on the advisory group. In fact, I had to reassure the medical members of the advisory group that it wasn't going to be entirely a midwifery-based advisory group, so there's a good balance and a very strong midwifery representation who are putting their case very well, I'm told.
Right. And does the Commonwealth, given the importance of the continuity of care for midwifery services, is there any plans for mechanisms to encourage, or is it expected to have mechanisms to encourage the state and territories to actually restructure their maternity services to make sure that women have continuity of care for midwifery services?
I think that's a big issue. I think only Queensland really has any sort of formal structure where community-based midwives are integrated into the public health sector. I think there's some other states and territories have birthing units, but they don't tend to have that same link with community-based midwives, and that is a big issue because privately practicing midwifery is a very it's a very uncertain situation at the moment because of insurance and all of those issues. So there is a strong view from, I think, some of the obstetric doctors and some of the midwives that the public birthing systems in the states and territories should have a better incorporation of midwives. Now, at the moment, as I said, only Queensland seems to have developed that sort of model, and I'm sure the advisory group will be encouraging the other states and territories to look at those models.
So you'd then be looking at whether there were mechanisms, potentially funding mechanisms to, get states and territories to improve their practices? Well,
the states and territories obviously are responsible for those services. The Commonwealth provides its share of money through the national health agreements, but ultimately the provision of and the nature of those services are a matter for the states and territories. And as I said, Queensland have developed their model, but I'm sure there will be encouragement from this group and to do some more work in that space.
The other issue related to that is then sort of data collection, and so I'm interested to know whether there are plans at this stage, sort of going into this review, to be sort of measuring and reporting on women's access to continuity of care.
I'm not aware of that sort of detail, Senator.
Right. So could you...
That could be taken on notice for Ms Cole, Ms Toms to answer when she comes back.
Can I just add one thing, Senator, which is that the discussion paper that Ms Cole referred to is actually a consultation paper, is available on our website and does cover some data and the range of issues that are being considered. It's available on our website.
Right, okay, but and it probably says on the website what the timing of the process is going to be.
I think, Senator, the consultation process is due to be completed on the 18th of June, and there are a range of questions that are being asked. And to go to your point around continuity of care, I think it's looking at all the different all the different models of care that apply, and making sure that there are improved health outcomes for mothers going through pregnancy and post for the child and the mother as well. So I think that absolutely should pick up what's the best pathway of care depending on the individual. So, yeah.
I suppose some of the midwifery people, given that there aren't, they haven't got that sort of community representation on the project reference group, are concerned that those issues aren't going to end up coming out at the forefront as they believe that they should.
Senator, my understanding is that the advisory group is a very powerful is providing the most of the information. The reference group is coordinating the process, but the advisory group is providing very strong and forthright input into the plan. So that was the impression I was given.
That's certainly my understanding also. It's a broad range, it includes across the whole spectrum, and it is definitely the case that the consultation process is scheduled for May and June, with public submissions due, I think, on the 18th of June. The timeline, Ms Toms will know more, but also it depends a bit on the Commonwealth-State relations meetings and so on. Obviously, this is something that's been commissioned by Health Minister Advisory Council, and so it'll go back through the reference group to be considered at that high level. Right. We think later this year, but the exact timing we take on notice so as not to...
Is there concern that the previous plan was finished? It was only meant to be until 2015. It was completed almost 2 years ago now, and it sounds like it's going to be still quite a lengthy period of time before we have this new strategic approach finalised?
I think the consultation paper actually refers to the previous plan and the report that Ms Cole referred to and what's been done with it. So that will absolutely feed in to this next plan. It's not as if there's been nothing happening as a response, but it is certainly, I think there are annual progress reports provided and this final report. And I think the attachment to the consultation paper, from my memory, says what's happened with each of those recommendations. So the advisory group and the consultation process will pick up some of those comments.
Okay, thank you. Thank you, Chair.